Welcome back to WKRG News 5 at noon. It's Friday and the doctor is in. Today we are joined by Dr. Nicole Angel with the Southern Cancer Center to talk about the dangers in delaying routine cancer screenings. And a lot of people out there are probably saying, oh my gosh, I am behind on a lot of my doctor's appointments because of coronavirus. So what types of cancer screenings should people be getting routinely?
So for men, they should be getting colonoscopy every 5 to 10 years. The prostate once a year, prostate screening, and a good skin exam every year, especially if they're over the age of 50. And women should be getting their mammogram, pap smear up to a certain age, colonoscopy, and the skin exam for the woman. And we definitely saw a slowdown in the number of patients because a lot of our patients come from these cancer screenings. That's how they get diagnosed. So when the shutdown started in March, we were sitting there twiddling our thumbs for a while. It's everything is starting to open up, and diagnoses are coming again. But I think there are some things that there's a risk and benefit to everything, and I know people are nervous about going out right now. And I think every situation is different. Everybody has different health concerns, and there are a few alternatives. So the mammogram is pretty straightforward, and you can go in. If you go in the hospital, there's a screening process to get in the door where they take your temperature. You have to sign in. They give you your phone number in case anybody is found to have had it, and they want to let you know that you might have been exposed. But you wear a mask, you go have your mammogram, and you go home. So very low risk there. If you're having a colonoscopy, now any kind of surgical procedure in the hospital, you have to be COVID tested 1 to 2 days before, which helps to decrease the risk of getting it during the procedure. But that's a little bit more of a risk. Colon cancers are one of the slowest growing cancers that we have. So I think if you had to put that off, if you know you've never had cancer, if you're not having any bowel changes, there's no symptoms or anything, I think you could put that off. The alternative would be primary care doctors have different types of tests for stools for occult blood that could pick up blood that might suggest there was something hiding there. And as long as that was okay, for 6 to 12 months, I think you would be fine to put that test off.
Okay. Well, I know that so many people may have questions because they're listening to you going, I am that person, I haven't had this test, and we are going to give you the opportunity to ask Dr. Angel any question you would like about delaying cancer screenings, what tests you need to get, or if you have any other questions about cancer. She is our expert, and we're so happy to have her in the studio, so we want to give you the opportunity to ask those questions. And so log on to Facebook Live at 12:30, and she'll be ready and willing to answer those questions. Thanks so much, Dr. Angel.
Thank you.